Good morning, everybody. Thank you for joining us today on our 8th weekly webinar Wednesday. Can't believe it's already been 8 weeks. So hopefully you can all see my screen. And just some quick housekeeping while we wait for some other people to join us. We've got about 11 people online right now. Each one of these is roughly an hour-long webinar. Each one of these webinars, you need 3 of them to equal for 1 Master Dairy in-person meeting, just because those are generally 3 hours, so 1 + 1 + 1 is 3. I do need you to fill out the completion form to receive credit, as this is the only way I can record you. Once Arup gets started, I will copy and paste all of these links into the chat, so you can copy them directly into your browsers if you would like. All of the recordings are posted to the UT Dairy website and the Master Dairy page for later viewing. So if any of you have farmers who have missed one, if you yourself have missed one and you'd like to go back and view it, they are all available for viewing on that Master Dairy page. They're all also on our YouTube channel, but it may be a little bit easier to go to the Master Dairy page, click on the one you would like to watch, and view that for credit. The link is the same for reporting that you watched it through that form, that evaluation form. So again, just click on that, let us know that you watched it, and keep on rocking. For any of our agents who would like to go back and view these for in-service credit, they are all on a channel in Kate, where you can view them for an hour of in-service credit. And that is the last link on here, the tiny.utk.edu/dairy-in-service. Our speaker today is Arup Sen, and he is my PhD student. And he'll be talking to you all today about the importance of transition cow protocols and transition cow diseases. So with that, I'm going to stop sharing my screen. And Arup, take it away.
Can you see and hear my screen?
We can hear you and we can see your screen.
Yeah.
Do you want to stop your video?
Sure. Thank you all for joining us today in our today's presentation. Today I'll be going through a transition cow protocol for maximizing potential. For my presentation today, I have outlined my presentation. I will go through the transition period and then go through the transition cow diseases and transition cow protocol, which is my main focus of this presentation. So a dairy cow's life, which have several milestones. After she born, we breed her around 15 months, and then she calved for the first time, start her lactation. After waiting for around 2 months, providing her a voluntary waiting period, we breed her again, and we expect her to be pregnant again around 28 months. When she's still in her first lactation. And during 36 months, we provide her a dry period. And then during like around 38 months, she calve again and start her second lactation. So this particular period in dairy cow's life, when she enters from a dry period, calf, start her milk secretion, and enters her second lactation. In this particular period, the milk production requirement, that dairy cow cannot feed enough, like cannot have enough feed, like eat enough to produce, to fulfill her production demand. So during this time, she suffers from a negative energy balance. You can see in this graph. And we call this period, that is 3 weeks pre-calving to 3 weeks post-calving, a transition period. So transition means the cow make her transition from a pregnant non-lactating state during this dry period to a non-pregnant lactating state during this period. And during this transition period, there are some physiological changes that occurs to essentially all of the dairy cows. So the cow experience a state of insulin resistance during that time. She will have reduced feed intake around calving. As a result, she might suffer from negative energy balance. And as we have been selectively bred our dairy cows for producing more milk, they need more calcium, and as a result, they might suffer from a hypocalcemic condition. And the immune function also reduced during that time, which might accelerate the bacterial contamination of uterus. So all these changes during the transition period will make the cow susceptible to some diseases, which we call transition cow diseases. Now, there are several types of transition cow diseases, like the metabolic type is hypocalcemia, or we also known as milk fever. There is a hyperketonemia or ketosis and displaced abomasum. I'll be discussing these diseases in detail on the later slide. There are some reproductive disease of the transition cow, like metritis or written placenta, and some other diseases like mastitis, lameness. Now, these diseases occurs mainly like the incidence of this disease, the risk period of this disease is actually right after calving. So you can see that this written placenta, that may extend up to 1 day to day 7 after calving. So we call it written placenta when the placenta does not expelled out or failure to expel within 24 to 48 hours, but it may extend up to 7 days. And this hypercalcemia, the most occurring period is day 0 to day 4. Hyperketonemia or ketosis, the most incidents occur during this period, day 3 to day 10, but it may extend up to further, like up to 21 days. And all these other diseases, metritis, lameness, displaced abomasum, mastitis, you can see that these diseases may extend up to the day of calving, up to the 3 weeks period or day 30. Now, these transition cow diseases mostly occur post-calving. So the post-calving is the high risk period for the transition cow or fresh cow. Hypocalcemia. This is our milk fever. This is one of the diseases when due to the higher demand for producing more milk, the calcium concentration in blood that goes below 8.6. When it goes below 8.6, we call it subclinical hypocalcemia. When the serum calcium level goes below 6 milligram per dl blood, we call it clinical form. Now, during the clinical hypocalcemia, we will see a gradual progression of the disease. Like during the stage 1, the cow might suffer from hypersensitivity, excitability, and if you observe her, you'll see ear twitching. And if that cow is not treated during that stage, she might progress to stage 2, when she will not be able to stand, and however, she will still be able to maintain sternal recumbency. But her temperature will be subnormal, and she will be inappetent and dull. And if the cow is not corrected during that time, her condition will progress to stage 3, where she will not be able to maintain sternal recumbency. She will lie down on her side, and she will be unresponsive to stimuli. Her heart rate will be increased, however, you will find a very weak pulse. Now, for hypocalcemia, there are losses, like mainly losses due to death if they are not treated. There are 60 to 70% death due to the hypocalcemia if they are not treated. And the premature culling, which may be up to 12% of the affected cow. And hypercalcemia also reduce the milk production by 2.4 to 6.4 pounds per day. And there is also associated treatment cost due to the hypocalcemia or milk fever. So the treatment for hypocalcemia or milk fever comes in a form, is actually providing calcium. So the calcium supplement can be provided through bolus form, intravenous calcium, or subcutaneous, where we use intravenous calcium when we need to faster availability of calcium in the blood. And subcutaneous form is used when we want longer sustainability of calcium in the body, in the system. However, one need to be careful while administering intravenous calcium, because if you do not maintain the proportion that you are supplying to the system, the cow might die. So the most convenient and easy way to supplement the calcium to the cow is bolus form. It is recommended to provide one bolus right after calving, and another dose 12 hours after that. Now there are several like different forms of calcium bolus. Some are quick release calcium supplement, which are used for faster bioavailability of calcium in the blood. And some provide sustained release of calcium, like calcium sulfate. And some of them also contain propionate, which actually produce a precursor for glucose production. Now, one thing that needs to be mentioned, that these boluses might be caustic or irritating for the cow. So quick administration is actually recommended. Hyperketonemia or ketosis. This actually happens when the cow cannot eat enough and she's in negative energy balance. And for fulfilling the energy, she mobilizes her stored body fat. And due to the incomplete oxidation of the fatty acid, there is production of ketone bodies. Whenever the ketone bodies production goes above a high level, so when the ketone bodies production goes above 1.2 millimole, we call it subclinical hyperketonemia or ketosis. When the ketone body production, which is beta hydroxybutyrate, that goes above 3 millimole per ml blood, we call it clinical form. Now, to test this, there is cow-side test available. As we test our blood glucose with a test strip and a drop of blood, this ketone strip that also require a drop of blood for testing BHBA in the blood. During the clinical form of ketosis, one might see reduced feed intake of the cow, and also there might be incoordination, gait abnormality, and lethargy. The cow might lick or chew abnormal objects, and there would be reduced milk production. Now, for the hyperketonemia, the losses due to hyperketonemia could be milk loss. A total milk loss that ranges from 277 to 1,177 pounds may occur depending on the parity. So whenever the parity increases, like a cow is in third parity or fourth parity, the milk loss will increase. And this hyperketonemia also increase the risk of death by 2.2%. And it also increased the risk of culling by 1.8%. So for treating hyperketonemia or ketosis, the most common drug is actually propylene glycol, which is actually supplying the cow with glucose as she is in negative energy balance. The recommended dose is around 310 gram propylene glycol, making sure that the cow gets this amount. Now, there are several other forms of glucose supplement like dextrose. However, dextrose is much higher priced than propylene glycol. And one can also use glycerol, sodium propionate, or calcium propionate, or glucocorticoid. One other disease, which is one of the most costly disease among transition cow diseases, is displaced abomasum, where the abomasum actually displaced from its normal position, which is right ventral part, to the right or left side. So abomasum get displaced and cannot come back to its normal position. And as the abomasum get displaced, there is lack of appetite, and there will be reduction in the milk production. For identifying these displaced abomasum, there is a cow side test available, that is ping auscultation. So using a stethoscope, trying to hear the sound ping on this side, you can see in the picture. And there could be a milk loss up to 2,486 pounds per lactation, and the death due to displaced abomasum could be up to 7%. The culling rate could be 11%, even after the displaced abomasum is corrected through surgery. And there is also associated cost of treatment. Now, for treating displaced abomasum, there are basically two methods. One is non-surgical, where casting and rolling of the dairy cow is done to bring the abomasum in its normal place, and there is surgical correction. When this procedure fails, there is surgical correction. One may approach from the right side or the left side, or from the ventral side, from this side, for correcting the displaced abomasum. Retained placenta, that is actually a failure when the placenta fails to expel out from the from vagina within 24 to 48 hours postmortem. And I also, as I mentioned it before, that it may extend up to 7 days. Due to the retained placenta, the milk production could be reduced by 3.1 pound per day, and the conception rate that is reduced by 14%. And there is this retained placenta that actually encourages bacterial contamination from the environment, which actually increases the risk of metritis and also the risk of culling. Metritis, it's a acute systemic bacterial infection, which is accompanied by fetid red-brown watery uterine discharge, which usually the cow will have fever or pyrexia. There is a cow side test available for identifying or detecting metritis, which can be done through uterine palpation. However, this Metritis device is a wonderful device for identifying metritis. You can see I have shown 3 of the pictures showing severity of the metritis. This Metritis device, this is the handle and this is a cup. You can insert this portion through the vagina, and this cup actually scrub out the uterine discharge with it, and then you can compare this discharge with this scoring system. So whenever the discharge is clear to thick, viscous, where you will not find any foul odor or any bad odor, then we score it severity 1 or score 1. In the score 2, the pus will be white or yellowish. It will be thicker, and you might find mild to no foul odor. But in here, I'm not sure if you can see it, there is some red to dark red colored uterine discharge. These and this will have very much detectable odor, which is foul odor, and we scored them as 3. So when a cow is suffering from metritis, she might lose 500, around 600 pound milk per lactation, and her pregnancy rate could be lowered by 70%. Also, it increases the culling rate. Regarding the treatment of the metritis, we can use antibiotic, either uterine infusion or systemic antibiotic based on the severity of the metritis. And we can also provide supportive therapy like oral or intravenous saline. Metritis, this is one of the economic disease, most costly economic disease that we know of. It actually, there is actually a calcite test available for metritis, like California metritis test. When it is in subclinical condition, you will not see any clinical sign. However, if you test it by CMT test, you will see an elevation of somatic cell count. So whenever the somatic cell count goes above 200,000 cells per ml, the cow will be categorized as subclinically metastatic cow. And in clinical form, you see 1 or more quarter of the cow's udder will be red, or there will be swelling, heat or pain, something. And you will see visible, as you can see in this picture, visible abnormal milk secretion. That could be milk flakes or clot, or maybe watery appearance of the milk. Metritis actually reduces the milk quality, and early lactation milk loss could be extend up to 1,214 pounds from 242 pounds. The risk of culling due to the metritis could be up to 32.7%, and the treatment is actually antibiotic intervention. Lameness is when the cow have abnormal gait. Due to the lameness, the culling rate could be up to 26.4%. As the cow is suffering from abnormal gait, she has difficulty going to the feed bunk and to compete feed with other dairy cows. As a result, she might suffer from negative energy balance, which actually negatively affects her milk production. And it also decreases as she cannot stand properly. It might decrease as conception rate. Now, these all transition cow diseases are actually costly. As you can see, as I also told before, that displaced abomasum is one of the most costly disease among these transition cow diseases, depending on whether surgical intervention is needed or not. And the incidence rate, as you can see, which can extend up to 0% to 55%. And these costs actually include treatment cost, veterinary cost, milk production decrease, culling cost, or discarded milk due to antibiotic use. So all of this cost is actually associated with this disease only. However, the main problem, one of the main problem, or what makes it critical for the transition cow disease, is that these diseases are interrelated. So you can, that cost that I have showed you in the previous slide, that might not be the actual cost for these diseases. Say if one cow is suffering from hyperketonemia, she might have a greater risk of developing displaced abomasum or metritis or retained placenta. If one cow is suffering from hypocalcemia, which could be subclinical, she has higher risk of developing retained placenta, displaced abomasum, metritis, and even mastitis. So this interrelation between transition cow diseases makes it difficult to actually understand the impacts of these diseases. From this study, they have showed that whenever the BHBA, beta hydroxybutyrate level, goes below 1.2 millimole per ml blood during the first week after calving, that actually that cow is actually 2.2 times greater likelihood of developing displaced abomasum, and 2.6 times greater likelihood of metritis. If the BHBA goes below 1.4 millimole per liter blood during the first week after calving, there is a 4.2 times greater likelihood of clinical ketosis. And when the BHBA level is within 1.2 to 2.9 millimole per ml, okay. During the first week postpartum, there is 4.5 times greater likelihood of culling from the heart. And when the calcium level goes below 2.14 millimole, there is actually increased likelihood of displaced abomasum, ketosis, retained placenta, and metritis. So one disease can actually increase the risk of other transition cow disease. So what can we do? We cannot control the calving. We cannot control the physiological process or the physiological changes that the cow goes through during the transition period. What we can control is we can take steps to prevent diseases. We can detect the disease earlier so that we can treat it earlier. We can change or manage their feed intake and manage their nutrition. And for this controllable, for preventing, detecting, and treating disease, transition cow protocol actually helps a dairy producer with that. So what is a transition cow protocol? It's a guideline. It's a guideline or a plan of action which actually provide us some standard for. There are some major or important points, like it provides standard for monitoring, disease prevention, identification, and treatment of all major conditions common in fresh cow. Now, in the monitoring side, what we can do? Ideally, we can house the fresh cow in a separate pen for the first 10 to 14 days, so that like separating the fresh cow from other cows make it easier to identify disease, to administer treatment, or to aid the evaluation process. And also it provides them more space also more feed space, so that they do not have to compete for feed. We can monitor their dry matter intake. Making sure that the cow do not have to compete for their feed is actually crucial. And making sure they are having daily intake, like per cow daily intake, that actually meet their requirement. Under preventive strategy, we can provide them with a calcium supplement after calving to prevent the milk fever or hypocalcemia. We can also provide them with propylene glycol drench to prevent ketosis. 300 ml propylene glycol daily up to they are resolved from subclinical or clinical ketosis. And as the cow suffers from reduced feed intake around the calving, we can provide them a vitamin B complex to facilitate or to enhance their digestibility or appetite. Vitamin A-D supplement will help them with calcium metabolism. And there is one YMCP paste which contain yeast, magnesium, calcium, potassium. This paste provides micronutrients and some yeast for better digestibility of the cow. As a part of the preventive strategy, we can also make a drench for cow, for providing the cow on the day of calving, including calcium propionate, Epsom salt, potassium chloride, common salt, and propylene glycol. These actually provides a lot of supplements to reduce or stop the progress of the transition cow diseases. For disease identification, one need to examine the fresh cow daily. So like recording rectal temperature, daily monitoring their heart sound, lung or rumen for any kind of abnormality, checking the uterus for toxic, whether it is toxic or normal. with that we can do with uterine like uterine palpation, rectal palpation, or using a metric check device, and examining their manure quality for looking for any abnormalities in their digestibility, and looking for their abnormal nasal discharge, and whether they are suffering from dehydration, like looking at the shrunken eyes. And this is very important that when like the clinical disease are like the tip of an iceberg. So if you have one clinical diseases in your farm, it is most likely that you have 10 more subclinical disease, which actually represents the bottom part of the iceberg. So identifying these subclinical diseases is very important, because identifying those and treating them early so that these subclinical disease does not progress into clinical form is really important. If we identify them early and treat them early, that will increase the chance to resolve the disease sooner. And also it will reduce the disease effects on production and reproduction of the cow. So for identifying those diseases, there are some cow side tests available, like using keto strips for identifying BHBA level in the blood. There is California Metritis test kit for identifying subclinical mastitis. And we can also use ping test for identifying displaced abomasum. We can also collect blood and send it to laboratory for testing the calcium level in the blood for identifying milk fever. However, there is no such cow side test available so far for calcium level test. One other important factor, or one other important component in transition cow protocol is that training those personnel who will be performing those daily examination, who will be responsible for doing cow side test. Training those herdsmen is really important, so that they can visually identify sick cow and take action quickly, so that they can identify a lame cow or a cow with reduced feed intake or reduced milk production. And another thing that is important is recording and interpreting the findings. So if you find that your cow is having lower body temperature below 101.4 degree Fahrenheit, which could mean that the cow might be suffering from milk fever, ruminal acidosis, or shock. Like recording is important, because if you have just a day, like if you have a 2 days rectal temperature record, then you will not know, or you cannot interpret which way the disease is progressing. Is it decreasing or is it increasing? But if you have like previous 2 or 3 days of rectal temperature from a cow, then you will understand that infection progression, whether it is decreasing or increasing. And also keeping record helps us with following up treatment and supportive therapy. So these all, this is here to summarize what can be included in a transition cow protocol, like separating the fresh cow or transition cow so that the identification treatment becomes easier, regularly checking their feed intake, that is also making sure so that they get optimal nutrition, providing with calcium supplement and propylene glycol supplement to reduce occurrence or stop the progression of the hypocalcemia and hyperketonemia, checking the body temperature to identify, or checking and recording them to identify the disease progression, checking the uterus for normal or toxic uterus, whether there is metritis or not, doing some cow-side test for ketosis, displaced abomasum, metritis, mastitis, and physical examination. These things can be included in the transition cow protocol. Now, applying or implementing a transition cow protocol in your farm will help in several ways. Like in a study by Allset, they implemented a fresh cow protocol in a 1,000 dairy herd, and they saw that by implementing that transition cow protocol, the death loss can be maintained within 3 to 5% during the first 3 weeks after calving, as compared to the 17.3% for those cow who ends their lactation before 45 days. And the involuntary culling rate can be maintained within 20 to 24% as compared to the 38% annual culling rate. And the left, they saw that the left displacement of abomasum that could be reduced below 3% with any kind of fresh cow protocol. But with intense fresh cow protocol, the left displacement abomasum rate could be reduced below 1%. And they saw a peak milk production up to 18 pounds. So this is that study where they wanted to see when they initiated a fresh cow program and when they implemented a fresh cow program with a separate cow housing or separate cow pen, and the changes in the peak milk production. And they saw that when they initiated the fresh cow program, the peak milk production actually peaks when they add a separate cow pen. So the herds, the total milk production and the milk production per cow actually increases when, in addition to fresh cow protocol, there is a fresh cow pen is provided. And in this other study, where they wanted to see if treating the subclinically ketotic cows with propylene glycol helps the cow not to develop clinical forms of ketosis. So they identify 4 dairy farms, and they tested the dairy cow in between day 3 to day 16 to identify the cow which are subclinically ketotic. So the cow that are having a blood BHBA level over 1.2 to 2.9 millimole per ml, they were categorized as subclinically ketotic. So after identifying those subclinically ketotic cow, they assigned them randomly into 2 groups. One is control group, one is propylene glycol group. So one group did not receive any propylene glycol treatment, and another group received propylene glycol treatment. And as you can see from this graph, it is clear that the control group, which were subclinically ketotic but did not receive any propylene glycol treatment, they had a more risk of developing clinical ketosis as compared to the propylene glycol group, who had less risk of developing clinical ketosis. From these two studies, it is clear that if implementing a fresh cow protocol in the farm that helps with the milk production and treating, like identifying and treating disease earlier, that helps with reducing the disease progression to clinical form. This is one of the transition cow protocol example that is used in Pilchuck Veterinary Hospital by Allset. Here, from day 1 to day 10, they had several things listed. So on day 1, they provided a drench to every fresh cow that is prepared with calcium propionate, Epsom salt, different parts of this ingredient like potassium chloride, common salt, propylene glycol. And if any cow is suffering from milk fever, they provided calcium and magnesium intravenously on day 1. And from day 2 to day 10, they regularly checked body temperature, rectal temperature, and listed the health status of the cow. And on every alternative day, they checked the uterus through rectal palpation to see whether the uterus is toxic or not. Based on their recorded things in this protocol, they set several protocols, like when the temperature is normal in between 101 to 103, and the cow also look normal, they will just continue daily checking of the health status up to 12 days. But if the temperature is below 101 and the cow looks sick, they treat that cow with calcium and magnesium intravenously. And also they treat them for ketosis. But however, whenever the temperature goes above 103, but the cow looks normal. So at that time they check from rectal palpation. If they see that the uterus is toxic, they set one protocol for treating those cows. But at the same time, if the temperature goes above 104 and the uterus is toxic, and also the cows look sick, they use different types of antibiotic for treating those cows. So these are the protocols they set for their dairy farms. Now, this protocol could be different. This protocol could be different in from farm to farm. And the protocol will be set based upon the farm setting. So not necessarily every farmer do have to have this single type of protocol. This is just one of the protocol example that I am showing that is used in Pilchak Veterinary Hospital by Allset. So for my take-home message, transition cow diseases impact are actually greater than what is realized. We can see some of the disease where the clinical signs are apparent. However, if we do not look for the subclinical diseases, we cannot know if the cow is suffering from any disease. And that might lead to some other diseases and affects the cow production and reproduction. So prevention and early diagnosis actually reduce the disease incidence or the disease progression. And having a transition cow protocol that actually aid in early disease detection, prevention, and also treatment. With that, I thank you all for your patience and hearing me through this, and I'll take any question.
Thanks, Arup. We did have one question in the chat, and I just kind of wanted to provide some clarification on it. If you could go back, Arup, to the slide where you were talking about the drench prevention strategies, I think is where it was. Yeah. Perfect, this one. So instead of parts, guys, this is actually pounds. So it's 1 pound of calcium propionate, 1/2 a pound of Epsom salt, 1/4 pound of potassium chloride, 1/8 pound of salt, and then 12 ounces of propylene glycol. And you would dissolve all of that in roughly 5 gallons of warm water, and then rinse your cows with it. Yeah. Are there any more questions from anyone attending? Thanks, Roop. That was a good job on that presentation.
Thank you.
You can unmute and ask it, and I'll call you in the queue, or feel free to write any questions in the chat. All right, thanks guys. We're gonna let you go a little bit early here today and go enjoy the rest of your lunch break. Thank you for joining us, we appreciate it.
Appreciate that, thank you.